Now let's understand that how the injury forms. Okay, and after this we can start writing. So what happens is there is a trauma, okay, which we will call primary injury. Let's say someone has hit the other person by a stick on head. Okay, so this is primary injury. This leads to cerebral ischemia, inflammation due to the stimulation of pro-inflammatory cytokines, and redox imbalance. Redox imbalance. Basically, I'm going to talk about the oxidative stress. Okay, redox, reduction and oxidation. Fine. So this is there. All this ultimately leads to what? Blood-brain barrier disruption, or we say alteration. That is, we know what has occurred: altered blood flow. Altered blood flow has taken place. This will lead to what? This will lead to one side neuronal and glial damage. That is, one side it will lead to neurotoxicity, and on other side it will lead to oxidative stress. Oxidative stress. Okay, oxidative stress. So what happens? Primary injury leads to disruption of the blood brain barrier, then it leads to the neurotoxicity and oxidative stress. Understood? This is basic. Okay, then comes the phase of secondary injury. Secondary injury occurs hours or days later. What all it includes is, by this time the oxidative stress has increased. Okay, oxidative stress has increased. You must have learnt in your pathology that there is a what we say reflux, calcium reflux, which causes injury. So there is a modified calcium release which leads to reflux injury. Then inflammation is increased. Then axonal damage is there. What all this leads to? Now this leads to cellular death,